I'm Matt Willis, Public Health Officer with the COVID-19 response update for February 8th. I'm going to provide some good news about our progress against COVID-19 as a community, and then drill deeper in the status of vaccine distribution. COVID-19 case rates continue to decline in Marin and are less than half of what they were 1 month ago. We've moved from the regional stay-at-home order into the purple tier in the California blueprint for a safer economy, and will enter the red tier if this progress continues over the next few days. Our percent positivity among those who tested continues to decline, and testing rates are about twice the state average. ICU capacity is improving, and our hospitals are experiencing reduced COVID-19 cases. 9 out of 10 schools in Marin County are open to classroom-based learning, which is among the highest in the West, not just California. We see each day that a child is in school joining their classmates and teachers as a success. Every day, that's the reality for over 17,000 Marin students. This week, we'll reach an important landmark with schools. 1 million combined days in school, physically in classrooms, for children across Marin since we began reopening on September 8th. That's something the whole community can be proud of. In those 1 million student days, we've seen 10 cases of school-based transmission, and none from a student to an adult. We've learned that when done right, in-person school actually protects against virus transmission, compared to the alternative of less structured days and settings where schools are closed. Not to mention the social, emotional, and educational benefits compared to purely screen-based learning. And more schools will reopen when we achieve the red tier. Regarding vaccinations, 35,000 of our residents have been vaccinated with at least 1 dose. That's 1 in 8 of us. I know it feels like it's inching along, and we all wish we had more doses to work with. Our vaccination clinics are fully staffed, ready, and eager to vaccinate all of us when we get more supply. Our healthcare workforce has been vaccinated, and we have now covered well over half of our residents over age 75. We estimate we'll cut our death rates in half by March, because 3 out of every 4 COVID-19 deaths in Marin occurs in someone aged 75 or over. Large-scale vaccination sites have been established in 3 locations, and a 4th is on track for later this month, with several smaller sites and mobile units. The Marin Public Health Mass Vaccination Site has vaccinated over 20,000 residents so far in that one site alone, averaging about 1,000 per day or 3 per minute. All of these operations are scalable to increase vaccination rates once we have more doses to work with. All of these are positive signs: flattening the curve again, reduced case rates, kids in safe schools, vaccinating our most vulnerable with the doses we have. The biggest challenges we face are 2. First, preventing another surge as we reopen our economy, and we know how to do that, with covering our faces, social distancing, and avoiding indoor gatherings. The second is the lack of vaccine. Between Marin Public Health and our hospitals, we are geared up and ready to provide the 500,000 or so doses it will take to vaccinate our entire community by the summertime. In the meantime, while we wait for the supply chain to get into gear, we're grateful for your patience, for allowing those who are most vulnerable to have access first, knowing that we're going to get to everyone. Thank you for doing your part.